Good afternoon and welcome to a special edition of COVID-19 Update for the Town of Plymouth. I'm Steve Triffletti, Plymouth Town Moderator. I'll be your host for today's special presentation. This forum is being brought to you live by PAC TV on Comcast Channel 15 and Verizon Channel 47. You can also watch this on PAC TV's streaming channel by going to pactv.org/live. For questions during today's forum, please email plymouthinfo@pactv.org. These forums can be replayed at pactv.org/Plymouth. Today we have a panel joining us, Dr. Philip Triffletti, he's an attending physician at Beth Israel Deaconess. Also, Dr. Barry Potvin, he is the chair for the Plymouth Board of Health. Carilyn Rains, she is the Director of Health Services at Plymouth Public Schools, and Plymouth State Representative Matthew Muratori. And we're going to go right to Dr. Philip Triffletti. Welcome, Phil.
Hi, Steve. Thanks again for having me on the show today. Obviously, there's a lot going on right now with our COVID-19 risks of infection, and we're having surging infections here, both in Massachusetts, locally, as well as throughout the country and throughout the world. So there's a lot of new information to really be looking at right now. I wanted to start, of course, by talking about Omicron, and I'm sure many of you have heard about Omicron, which originated in South Africa, and it is really spreading quickly into other parts of the world. So there's many parts of Europe, like Denmark, for instance, where they're seeing a majority of their variants are now Omicron instead of Delta or other variants. In Ontario, just north of the border in Canada, they expect to see the dominant variant within about 2 weeks to be Omicron. So there's a lot of spread of Omicron, and they have a thing called the doubling rate, which has a very fast doubling rate. So it seems highly transmissible, more transmissible than Delta. So we do expect it's going to be spreading very fast, and that we're not really sure what the impact will be for all communities. In South Africa, where there was a lot of infection with COVID, so a lot of people had natural immunity, and there was less use of vaccines in South Africa. That it seemed like there was less problems with severe cases, but I still would be very concerned about how this might play out in other countries, including the United States, because if we get overwhelmed with a lot of cases of breakthrough infections that we're not protected from by virtue of, say, our Pfizer or Moderna vaccine, which is likely, then I think we could see a lot more severe cases building up in our hospital system. So I think there's a lot of cause for concern. Data released recently about the effectiveness of the Pfizer vaccine. It appears it may only be about 33% effective if you've had 2 vaccines to prevent infection with the Omicron. So that means 2 out of 3 people would be susceptible to getting infected, even if they've been vaccinated. There's not much data yet on the 3-shot series to know how much more protection you get from that 3rd shot. But I'm sure as time goes on, we'll have quite a bit more information about that. There was, you may have seen in the news yesterday, just as an example of how much spread can happen at Cornell University in Ithaca, New York. They're having a big outbreak there of about 500 cases in the last few days. So they've partially shut down the campus, and they think that is going to be shown to be Omicron that's spreading rapidly throughout the campus. So, lot to go on. I think that when you look at something like Omicron, if the vaccines are not going to protect us, we're going to have to go back to the old-fashioned way of protecting one another. I think, the biggest risks still are being indoors without masks. So I think, doing activities, if you can wear a mask indoors, that's the ideal thing, or outdoor activities when possible. But, we're going to have to do a lot more, I think, mask wearing than we're doing. In the state of Massachusetts, as our recent survey showed, about 61% of us were wearing masks a few weeks ago. But as we've had a surge in our Delta variant here in Massachusetts, the mask utilization has gone up to about 67%. So you'll probably see more people, wearing masks, which I think is a good thing right now, and obviously social distancing. I did a little research on mandates just to see, I've always thought mandates might be helpful. I've had anecdotal reports from CEOs and others that run companies. They've had some good success with mandates. It turns out that to the extent mandates have been studied, both globally and here in Massachusetts, it's not clear that mask mandates or vaccine mandates are very effective at this point. But I still would say just do whatever you can to encourage your friends and family to, get vaccinated if they're not vaccinated. I think if you're going to have holiday gatherings, I'd be selective about how many you do. I also would strongly recommend doing rapid testing the day of the event to lessen the risk of spread. So that's what I have to start. Happy to take questions and comments later. But thank you for having me today, Steve.
Thank you. And that's Dr. Philip Triffletti. He's an attending primary care physician at Beth Israel Deaconess. You can send your questions to us at plymouthinfo@pactv.org. And at this time, we're going to continue as we welcome back the chair of the Board of Health for the Town of Plymouth, Dr. Barry Potvin. Welcome, Barry.
Yes, thanks, Steve. Didn't think we'd be doing this again, but we are. So here we are. I'll give you as much up-to-date data as I can as quickly as possible, again, by using this screen share system. Let's see if I can make sure I get this. Okay. Everyone should be able to see that now, I would hope. Oops. Let me go back to. So this is the graph that I've been doing for I don't know how long. It's getting a little old doing this, but you can see, I believe, way over on the right-hand side, the data that came in from the State Department of Public Health. And this came in on the 9th of December. And if you look at this, you notice, first thing you'll notice is that the really large peak we saw previously was last January. And now we seem to be going up as if we're approaching it. It looks like this is going to be a seasonal sort of thing that we're just going to have to deal with during colder weather. These are the data that I could assemble for you. It was as of December 9th, so it's a little dated now. We actually now have 50 million cases in the US and around 800,000 deaths. And you can see that things have changed a little bit, but for the most part, what you see is that there are a lot more cases, and it's obviously concerning for everyone. This is the state map. You can see that as of December 9th, every county in Massachusetts was now considered high risk for COVID transmission. And this is being caused by the Delta variant. Doesn't really show anything involving Omicron yet. I'll talk about that briefly also. They also gave some data on clusters of cases. And as you can quickly see from this, in Massachusetts, household transmission accounts for the vast majority of the new cases that we're seeing of this, followed by much fewer but still considerable amounts in child care, long-term care, K-12 schools. But that's true for ongoing clusters and for new clusters of cases as well. This again is state data coming from the CDC. And this again is the peak we saw last January. And if you look way over on the right, you can see that we're rapidly approaching that peak, and there's an awful lot of cases coming up in Massachusetts at the moment. This is the hospitalizations, and I just got the latest data as of a couple of days ago. For a long, long time, the hospital admissions, the daily bed use, and also the daily ICU use was pretty darn low and stayed low. So this is for Plymouth County hospitals, and you can see that there has been, again, quite a large jump, and it seems to be mimicking what happened last January, as far as we can tell. This is our vaccinations. As of December 7th, there'll be new data coming out on Thursday. Down at the bottom, you can see the total vaccinations for fully vaccinated people is 67% of the Plymouth population. And one or more doses is 76%. This is lower than the state average by about 6%. As you can see, the 5 to 11-year-old group is now included too. They're also now eligible for the Pfizer vaccine. 23% is low, but this is just the beginning. But this is still actually 12% below the state average. The 12 to 15-year age group is 15% below the state average. The 20 to 29-year-old group is 11% below the state average, and the 30 to 49-year age group, again, is 16% below the state average. So we're doing better than some places, but we're doing worse than others, and we're still, unfortunately, below the state average. Just to reinforce that, here's what's going on with the youngest age group. So if you look through all the data they released last Thursday, you can see the highest percentages for vaccinations of one or more doses for the kids that are 5 to 11 involved Hingham, Situate, Norwell, Duxbury, a few others, all around 40 to 60%. The lowest percentages involved Brockton, Wareham, Middleborough, Carver, Whitman, and Halifax. These are confined just to Plymouth County. Down here in the town of Plymouth is the 23% that we have here. The Massachusetts state percentage vaccinated with one or more dose for the youngest kids is 35%. So here's some quick information about what you should try to do for the holiday celebrations. Vaccinations, same thing as before. Become fully vaccinated. If you're eligible for a booster, you certainly should get it as quickly as you can. You need to wear a face mask covering both the mouth and the nose, especially in indoor public locations. Federal law requires that you wear these at all times in airports and on planes. Violations can result in arrests, fines of thousands of dollars, and bans on all future airline travel. My wife and I did travel for Thanksgiving. What we observed was that there were some younger people that weren't wearing masks in the airline waiting areas down near the gates. They were being shunned, and there was like a huge gap of nobody sitting anywhere near them. There were occasional people on the planes, in spite of the federal laws, that were wearing masks that weren't covering their mouth and nose. And that's not a lot of people, but there were a few. One day before the gatherings occur, if you're going to go to Christmas parties or family gatherings, you should try to make sure you use a rapid antigen at-home test kit, such as Binax Now. They're often not in stock when you go to the local pharmacy, but I discovered you could get them with an online order. And if you order them online, the kits will be delivered to your home without a shipping charge and arrive in about 3 to 5 days. So I would urge everyone, if you're planning to gather together for Christmas holiday celebrations, you should get one of these kits ordered and delivered so you can use it about a day before the holiday gathering if you possibly can. They come with 2 tests per kit. It's meant for the same person. And so what they recommend is that you should test just before you go to the gatherings, and then you should test again 3 to 5 days afterwards using the stuff in the kit. Be very cautious if you're going to be around older individuals and others whose immune systems may be compromised. Their immunity to infection is lower and can fade more quickly after the vaccinations. So the bottom line is you've got to use some common sense and be cautious. Parties, Christmas parties are being canceled, and in other cases, they're still going on, but in some cases, the invitations that I've seen say that those who are not vaccinated should not attend. So people are being very upfront about this. They just don't want people who aren't vaccinated going to these gatherings. This is other stuff about the Omicron variant, so it's just adding on to what Dr. Phil said. This virus has accumulated about 50 mutations, 26 alter the spike protein against which the vaccine-induced antibodies are targeted. Very preliminary data still indicates a 3.2-fold increased infectivity associated with this Omicron variant. It certainly does contribute to household transmission. The virulence, at least so far, doesn't seem to be more severe than what we saw with Delta. Cases seem to have mild symptoms, didn't usually require hospitalization. Studies that are underway about the effectiveness of vaccinations, including the boosters, shows that 1 or 2 shots of the Pfizer vaccine, there's still, as Dr. Phil stated, reduced efficacy against the Omicron variant, but the boosters do help. They greatly increase antibody levels. So even if they're less effective against Omicron, if you get a lot more antibody, it somewhat overcomes that reduced efficacy. According to the Mass DPH, this was webinar information from yesterday, there's been so far 16 confirmed cases caused by Omicron It's been in 4 Massachusetts counties, not yet including Plymouth. Most of them are in the 18 to 39-year age group. A third of them involve international travel. 80% of them were among people who are already vaccinated. Many of them had already received a booster dose, but only one was briefly hospitalized. Their symptoms were mild, including things like coughs, fatigue, congestion, and headaches. Additional surge in these cases is anticipated, which unfortunately is going to add to our existing surge already occurring because of Delta. And everyone, including the hospital officials, are expecting increases in influenza vaccination infections to occur also. So I'm going to stop the screen share there. And I'll be happy to answer other questions. I'm hoping and sure there will be some. Thanks a lot.
Thank you, and that's Dr.
For
Barry.
everyone, and thank you particularly for Steve.
Thank you, Dr. Barry Potvin. He is the chair of the Plymouth Board of Health, and at this time, we're going to continue with the Director of Health Services for Plymouth Public Schools, Carilyn Rain. Welcome back, Carilyn. Thank you for joining us.
Sure, thank you for having me. Hopefully I can put a little bit of a positive spin in terms of COVID in the schools. We're working really, really hard to keep our students and our families healthy. So just to give you a little bit of information, we have, and I think you may be aware, we're continuing on with our dashboard that we report all of our positive cases to the school community and community at large every Wednesday. That's updated and will be updated this afternoon. And also every Wednesday, our district administration shares the positive staff and student case numbers with the Department of Education. That is one of the requirements that they've imposed on schools. So as part of our new activities this school year to keep our students safe and in school, we have implemented the Test and Stay initiative, which is something that the Department of Education has offered all schools across the Commonwealth to participate in. A third-party company has come in, CIC Health, and they are posed with the task of managing this initiative in all the schools. We've had some very good luck with them. We're not utilizing them to the full capacity because I think we're able to manage in district, but just to give you a little bit of information, the state had offered us pool testing, which is more of a prevention type initiative, which we opted not to get involved in. That was also offered last year as well. And we started the school year off with the Test and Stay program and with the symptomatic testing. We found that we were getting people, kids, staff maybe coming into school not feeling good. So we decided at one point a few months ago that we were going to stop doing the symptomatic testing. Or stop offering that. So right now we're just doing the Test and Stay, which is basically boils down to is that when we have a positive case identified in the classroom, whether it be a student or staff member, our health services staff begin contact tracing for close contacts of that positive student, looking certainly in the cafeteria at lunch, looking in the classroom. We've certainly done so much and implemented a lot of strategies in the classroom to minimize close contacts, which I think has been really, really helpful. Obviously, instruction and learning are critical. And so this is definitely probably posed some strain on teachers, but I think overall we've been really successful with this. The contact tracing process is really laborious and time consuming in terms of the nurses making calls and the health aides making calls to the families, just reviewing a lot of the information on the guidelines because a lot of them have changed since the last school year. So a lot of this involves a lot of education. So the families can opt in to a Test and Stay initiative with their child to test. It's a 7-day testing period where the child is obviously not tested on the weekend. But if the 5th day of testing comes on a Monday, the child will come back to school and finish the testing on the Monday. We've done approximately 3,300 COVID tests using the Binax Now rapid antigen testing. And we've shown, and we're actually a little bit better than the state average. Our positivity percent rate is only about 0.3%. So looking at, this particular initiative and how it has kept well over 3,000 of our students in school and in the classroom as opposed to being home quarantining. So in looking at, obviously the semantics of the program and how time consuming it is for my health service staff to be involved in this, it is definitely has a positive benefit for our students. So more of our kids are in school, which is great. Families can certainly opt out of the testing. And if that's the case, the student has to quarantine as they would have previously last year. Our nurses do the rapid antigen testing in the morning before school starts. We have a different process maybe in every school based on what's working well for families. And so, it's a 15-minute wait time. So we know pretty quickly after a student has been swabbed. We've done some other proactive things as well. We hired two new additional part-time health aides for the mornings to help out with this. Because again, it has been certainly taxing and burdensome on the nurses to have this additional task every day. So I think that one of the things that we are aware, and we still work very closely with the Department of Public Health epidemiology team, and they've just said, there are chances in cases where, positive results can be false. So in that case, we have been recommending to our families, as always, stay connected with your primary care physician. And if you can get a PCR test done within 24 to 48 hours from the positive rapid test, and if that shows negative, the child can come back. But one thing we do know is that in-school transmission is very, very low. Most of our transmission obviously is happening either in the household or out in the community when kids are participating in other activities. So again, we really stress, in combination with our test and stay program, we really strongly are still encouraging, good hand washing. The kids are wearing masks, and we encourage all of our all members of our school community to please stay home if they're not feeling well. The other piece, I think, along with, with COVID and with the testing, is we have also partnered with some of our community partners to provide vaccine clinics. So early on, when the older kids were 12 and up, were given an opportunity to have the vaccine, we partnered with Harbor Health, and they offered multiple Plymouth Public School clinics specifically for our families, which many took advantage of. So that was great. With this go around with the 5 to 11 year age group, we were able to partner with the Department of Public Health and Fallon Ambulance, and held a vaccine clinic at PCIS, where approximately 180, I believe, students received their first vaccine. The second vaccine will be coming up right before Christmas, a few days before Christmas. And so, that was obviously another successful partnership. In looking at our vaccination rates for our students, we have over 3,000 secondary students. The vaccination rate is a little lower at the middle school level, with about 50% of our student population vaccinated and about 60% of our students at the high school level.
Do you want to finish at 12?
And again, looking at the numbers, one of the things we were able to do is we were able to link our electronic health record with the MIIS. And so we are able to, log on and get data shared daily for any new vaccine that has been administered out in the community. So, looking at, once the 5 to 11-year-old group is getting their second vaccines, we'll be able to get a good idea of what percentage of our students are vaccinated at that level as well. The mask piece is continuing on, so I don't see an end in sight for that in terms of the state guidelines. One of the things I do, I do think that has been really, really important is that anything we can do to communicate information to our families. We have a Healthy Headlines newsletter we send out. I know all of the schools have communication and newsletters that they send out, and my nurses do as well. Some of them have websites. And again, stressing the importance of collaborating with your primary care physician. And, and we've been really lucky. Families have been great. And, certainly very open and honest with us about different cases that have, come up in their families, and just trying to work together, to keep everybody safe. One of the other things I think that's always great, we've always been able to sort of brag about our return to class rate. And even considering all of this with COVID, our return to class rate is still up right at 96%. So 96% of our students who are accessing the health office are returning to class. So that's, certainly great. Because again, we're turning into little public health facilities here, but we're also primary goal is learning and education. So we're keeping our kids in class, and that's probably been one of the best things we've been able to do.
Thanks,
So unless
Carilyn.
anybody has any questions, that's about it.
Thank you. We're going to go to State Representative Matthew Muratori. Matt, a lot has happened since the last time we presented. What do you have for us?
Yeah, absolutely, it has, and thank you for doing this again. I think Barry laid out the very well and where we're at, and if you do it in comparison, we actually have right now 5 million residents in the Commonwealth fully vaccinated. That's 72% of the entire population of Massachusetts, and it's about 90% of those eligible. So the vaccinations continue to go. Breakthrough cases, though, have hit 100,000, which is 0.02% of the population has breakthrough cases. With 700 of those breakthrough cases have led to deaths. And the breakthrough cases, Steve, again, is the cases where people have been fully vaccinated. So the number is still relatively low. The hospitalization part, Steve, as Chairman Potvin brought up, the hospitalizations continue to be on the rise over the last month. We're at over almost 1,400 folks in the hospital with COVID now, with about 402 of those are from breakthrough cases, again, fully vaccinated. With those 1,400, 304 are in intensive care and 165 have been intubated. If you compare those numbers to where we were at the height of this 2020, in the spring of 2020, we were actually at almost 4,000 hospitalizations. So we're nowhere near that point at this point, and what we're seeing is people aren't getting as sick as they were, but they're still troublesome to see these numbers. With regard to the mask mandate or discussion about that, there's been a lot of discussion at the State House about the mask mandate. Nothing at this point that it's going to be a mandate. It's obviously a strong recommendation to continue to do that, particularly if you're in public places. I was just at the airport over the weekend, and I could attest to seeing, I didn't see anybody without a mask at the airport. So I think people understand when you're at public places, if you're not fully vaccinated with the booster, wearing a mask is the best thing to do. And particularly if you're compromised with your immune. So I think people are getting that message and have got that message. I do want to just briefly, Steve, talk about the test kits that actually came out this week. There's over 2.1 million test kits that are being sent to, I believe it's 130 municipalities. And I've already got questions from some select board members why Plymouth wasn't chosen. It's based on the socioeconomics of the communities. So the feeling is that there are communities out there that have residents that could utilize these test kits. The communities can get these out a lot faster to individuals that are in need of those, low-income places, low-income people, et cetera. So that's the feeling at this point. It will be reviewed in January. Other communities may be part of it. But there's also a reminder, too, that communities can go through the county, in Plymouth County, and go through the opera funding there to get test kits if they want to find them. I'm sorry, if they want to fund them, they will, so that you can actually get test kits if you want to give out to folks in Plymouth as well. And there's also the state funding for the opera money that's been signed by the governor this Monday. So there'll be more money coming out for that as well. So if communities want to go ahead and purchase test kits, they can actually do that on their own and not wait for the free ones to come. Walmart, I understand Walmart is actually starting to sell these test kits as of this past Monday for $14. So they're actually out there as well. With regard to boosters, I think this is where we really need to do the education on, which is getting people get the boosters. That really, it's great that people are fully vaccinated, that we have a large percentage fully vaccinated, but the boosters do make a difference. Right now, we have 1.5 million people in the Commonwealth with a booster. We really need to do a lot more work to get that number higher, I believe. 16 and 17-year-olds, it's now by the CDC recommendations that they can get boosters as well. So the more we can get our young people vaccinated, the better off we are as well. So that's the reminders for folks today, where we're at, what we're doing. And just a reminder, too, that if you do get tested positive, it's still a 10-day quarantine, and you notify your close contacts. So that's the update from the state here.
Thank you, Plymouth State Representative Matthew Muratori. In view of the time, I'm going to go back with our participants and have them give a 1-minute wrap-up with a couple of them getting a question. Dr. Phil, you and I talked last weekend about a recent death due to COVID complications in Plymouth, where the resident was vaccinated and yet still passed away after getting COVID at a local birthday party and later was in the hospital for an extended period of time. What's the possible explanation for that, and what should people be doing, since many people think that if you get the vaccination, you're not going to end up the hospital, or if you end up the hospital, you're not going to die? So what do you have to say to that, Dr. Phil?
It's a great question. Yeah, that's a great question, Steve. As Matt outlined, we have over 100,000 documented cases of breakthrough infection that in Massachusetts since the start of the pandemic. So that means people, just like you described, they got the vaccine, and then despite getting the vaccine, they still got infected. I think our statistics in our hospitals have been running something like, about 25% or so of people who are hospitalized with COVID infection have been vaccinated. So, the vaccines are terrific, and they've worked well against Delta and other variants. And, I think I agree with Matt, get that third shot. That looks like that's going to provide even more protection. But it is true, Steve, that with existing variants, there will be a small percentage of people who have been vaccinated who they might seem to be in good health. They might not be too old, but might still suffer the consequences of this virus. So, I think the message there is, we have to respect the seriousness and dangerousness of this pandemic. And as the community spread numbers go up, we have to take more precautions in terms of mask wearing, social distancing, et cetera. But anybody who's not vaccinated should be vaccinated. Anybody who hasn't got their booster should get their booster. And we're going to have to watch the Omicron very, very closely, because I think the Omicron is going to show a lot more problems with breakthrough infections. And you'll probably see more people also, getting into severe illness that otherwise would have been protected by our 3-shot series with Moderna and Pfizer.
Thank you, Dr. Philip Triffletti, attending primary care physician at Beth Israel Deaconess. Dr. Barry Potvin, as you wrap up, a question for you. Do you anticipate that the Board of Health will be planning some more local mandates for residents?
Well, yeah, obviously we're going to be having a Board of Health meeting actually a week from today. And on the agenda, I'm sure we'll be discussing what's going on and whether or not there are other things that we can do that might help to protect the population here in Plymouth. The Boston Globe front page today, headlines were COVID lessons still not learned, and new mask mandate urged and being debated. So I think that probably pretty much answers that. Yes, we'll be talking about it. And yes, it's possible the Board of Health members might decide that we need to do something further. In terms of other things, I'd be remiss if I didn't extend my gratitude and thanks, which is putting it mildly, to Matt, and especially Matt and Susan, but our other state representative also. The state and apparently the governor has now signed the budget. There is $200 million in that budget for 4 years of support for local boards of health and departments of public health. And we certainly appreciate it. We certainly need it, and we will do our very best to utilize it effectively. Other things I'd like to add just in closing is that wait and see really doesn't work in the case of COVID. You can't do that. This thing happens rapidly. There's a lot of unexpected things that happen with it, and you need to be sort of proactive if you possibly can do so. So I've got to wish everybody, please try to enjoy Christmas. Unfortunately, it's not what we hoped this was going to be for Christmas. Last Christmas, when things were getting bad quickly and we had no vaccines, we thought the vaccines would help us. They have. But we have to take precautions. We have to be aware that this is still not over, and it is seasonal. So we have to be cautious. Try to keep with people that you actually reside with. And if you can't and you're going to be together with other people, you really need to use those test kits. and to get the booster vaccine. Thanks, Steve.
Thank you. And we're going to go to Carilyn Rains. Carilyn, as you wrap up, one question. The local South Shore community didn't have many problems at the secondary level where many of the students are vaccinated, but at the elementary level, in a smaller school system, they had over 400 children recently quarantining. So what steps are being taken in Plymouth to assure that after the holidays, the children who may have symptoms are tested and possibly quarantined from the Plymouth Public Schools?
Sure. Well, I think that we'll probably continue just doing what we have been doing for children who either come into school sick or become sick during the school day. I mean, obviously evaluated by the school nurse and assessed, and looking, at the guidance we have from the Massachusetts Department of Public Health on, just looking at the symptom tree, really. And I feel like, getting the kids dismissed in a timely manner is going to be appropriate, following up with primary care physicians. There's only so much we can do to control this. We can certainly control our environment in the school, but so much goes on outside the school setting that has impacted this, certainly, as we all know. And we're just hoping. We have seen our numbers go up since mid-November. Just prior to Thanksgiving, our numbers did start going up, and we anticipate that they may continue to do that as they did last year through February. So again, just encouraging the mitigation strategies, encouraging families to, to stay safe. And just, we have great communication with our teachers. So if they, certainly observe or note a child not feeling well, they're immediately sending them down to the nurse. And again, we can only, so at that point we can be proactive and have the child dismissed and seen and tested before they can come back. I think one of the things that one of the state epidemiologists had suggested when referring our students to their primary care physicians for testing, that they can do a viral panel. It's not just COVID that kids are coming into school sick with. Obviously being in flu season, looking at strep, bronchitis, mono. There are lots of infectious diseases that can impact children's health and safety. So again, we're just doing the best we can moving forward to assure that we're not having anybody in school who's symptomatic.
Thank you, Carilyn Rains. She's the Director of Health Services at Plymouth Public Schools. We're going to close with Matt Muratori, our Plymouth State Representative. Matt, as you give your closing statement, as recently as yesterday, I'm being asked about a town meeting in the spring. Any thoughts yet about extending the legislation for remote participation for a representative town meeting?
Yeah, Steve, good question. Not at this point. I was actually in a meeting with the governor last Tuesday talking about this, and there's no indication that it's going to be extended at this point. We go back to session the early part of January, so we'll have a better idea then. But I think a lot of this, right now is because, the reason we're seeing the numbers Carilyn just brought up is really the numbers are up because, really Thanksgiving came, no surprise, and we see, more people getting together. The reason the test kits are actually being given out now is before Christmas, so you can be tested and be sure that before you go somewhere with family gatherings that you're okay to go. Right now, we're still doing 100,000 tests per day. The schools are doing 70 to 80,000 per test per week in the Commonwealth schools as well. So it's all about testing, and it's all about social distancing, masking, and hand washing, as we've talked about in the past, Stephen. I would be remiss if I didn't say, as a healthcare provider too, is be sure to get your flu shot as well. A lot of people are forgetting about the flu shot, but the flu shot will also help as well. So let's keep getting the boosters, get your tests, and get your flu shot, and we'll get through this.
Thank you.
Happy holidays, everybody.
Thank you, Matt Muratore. Thanks to all of our guests, Dr. Philip Triffletti, Dr. Barry Potvin, Carilyn Rains, and Representative Matthew Muratori. Also, special thanks to PAC TV for supporting us in this. We have Donna Rodriguez here in studio as our floor director, Nate in the control room. Want to thank everybody. We'll be bringing back special presentations as conditions warrant. My name is Steve Triffletti, Plymouth Town Moderator. Thank you for joining us.